Today we're going to talk about resistance training and specifically some of the safety considerations that we need to think about before we do resistance training. You're going to find that there's quite a bit of overlap with one or two of the previous modules, but I think repetition only makes it better for us to be able to remember and keep these things in mind as we engage in physical activity on this health journey. So we're going to start with a consideration that we need to think about if we've had a vaginal delivery. And in actual fact, we also need to think about this after a cesarean section as well. But when we do have a vaginal delivery, there is a specific consideration that we must take. Okay, so the first consideration that we have to think about specifically after having a vaginal birth are pelvic floor considerations. This will be a review. We did talk about the pelvic floor in a couple of modules ago, but this is a great opportunity for us to review. So although commonly thought of as the space between the vagina and the anus, the female perineum is a diamond-shaped structure, and it spans from the pubic symphysis, you can see that up at the front there, all the way to the coccyx, or tailbone as we commonly refer to it. The perineum is essential for supporting the pelvic floor, and when tearing occurs in childbirth, damage can be done to the muscle, veins, arteries, nerves, fascia, all that are, lie within that perineum. Tears can range in severity from a first-degree tear, so that's sort of just that first layer of skin around the vagina, to a fourth-degree tear, which extends from the vagina to the anus. A second-degree tear is typically the most common, and about 85% of women experience some degree of tearing in a vaginal delivery. Tearing can impact the perineum's ability to support the pelvic floor, and unresolved trauma can lead to urinary and fecal incontinence. So again, this is all really review from before. That thinning or tearing of the perineum can lead to other problems, especially if we don't give it the time that it needs to heal. When we think about resistance exercise, more often than not, when we're doing a resistance exercise, we're actually sort of pushing down or bearing down, almost like we're pushing to take a poop, a sort of Valsalva-like maneuver, or we're holding our breath when we go to do it. And this is what can lead to even more problems with the pelvic floor. We really need to consider contracting it and holding it quite tight when we're doing resistance exercises in order to make sure that we're not causing further damage, and we really need to make sure that we've given it the time it needs to heal before we can go ahead with resistance exercises. If you've had a cesarean section delivery, we do still need to consider the pelvic floor, but we also need to consider our abdominal muscles because of the major surgery that we have had. And this is especially true for resistance training. Again, this will be a little bit of review, but after having a cesarean section surgery or delivery, we really have to be conscious of diastasis recti. And so we did talk about this a few modules ago. But in a cesarean section surgery, this involves cutting through skin, fat, fascia, and the uterus. The abdominal muscles are actually separated, not cut. Typically after a C-section, you have an incision, and this is generally about 12 to 17 centimeters or 4.5 to 6.5 inches. And the resulting scar tissue can make the surrounding skin and fascia feel tight and restricted. In some cases, the scar can also be painful, tender, sensitive, or even lack sensation completely. So we really need to consider this before we can actually start any sort of exercise, but especially resistance exercise. And so what we really need to think about here is, once again, like I was talking about with the pelvic floor, we often bear down or sort of push down and push out when we're doing resistance exercise. And this becomes a problem if you do in fact have diastasis recti. All we're going to do is further amplify this sort of separation of those abdominal muscles. And so when we're doing resistance exercise, we need to consider both pelvic floor and diastasis recti and be really conscious of, almost sucking in and contracting those muscles and keeping those really, that sort of core area really contracted and tight when we're doing our resistance exercise. It's also quite important that you give your body the time it needs to recover before considering starting resistance exercise. Breathing when doing resistance exercise can really help for us to be able to focus on that pelvic floor and our abdominal area when we're about to do repetitions of a resistance exercise. So some other considerations that we need to think about before we can begin resistance exercise after having had a child would be prolapse. And so this again is review. This is when your pelvic organs start to slip out of place. And so we really need to be conscious that this is not happening. If you suspect prolapse or have a history of prolapse, you want to make sure that you have clearance from a physician, maybe from your gynecologist, obstetrician, before you go ahead and start with resistance training. Once again, often when we do resistance training, we're sort of pushing down to be able to lift something heavy, and that really works against trying to fix prolapse. Same with urinary and sometimes fecal incontinence. So this is leaking of the urine or feces. Again, same thing. We want to make sure that we have that under control before we really dive into a resistance training program. A couple of the other things which we haven't really talked about in great detail include postpartum hormones. So these are some of the things that we need to consider. And this is really important when we're thinking about our muscles and what hormones have been released and what effect they have on our muscles, so that we don't lead to tears and strains and pain, overstretching, these types of things. So really understanding what your estrogen, progesterone, oxytocin, prolactin, and relaxin levels are. If breastfeeding, relaxin levels will remain elevated, and what that can do is lead to ligament laxity and possibly pelvic or sacroiliac joint pain, even if you're experienced with resistance exercise. Next would be sleep loss. And so just knowing that obviously with a new baby, we're going to have disrupted sleep patterns, and so making sure that we're really focused on what we're doing with respect to resistance training, and that we're not making any mistakes or doing things without proper technique because we're just sort of so exhausted that we're not really thinking about what we're doing. And finally, depression. So this can affect your mood, obviously, and your motivation. You may just think, I'm totally not into this. It's not something that I want to do because I'm just feeling so depressed. And so these are all things that we just need to consider before we might start a resistance training program. Okay, so typically after having a baby, when you're in that postpartum period, we sort of think about this progression of resistance training or resistance exercises that we might engage in. So even if you have experience doing resistance training, we want to start small, as we've been sort of saying all along. So you'd want to start with some body weight exercises. So you can see the picture on the top left there. She's doing a plank. And so this is one example of a body weight exercise. We're not using any exterior mode of resistance except for using our own body weight. So this is things like dips and plank that you can see here, this sort of thing, that we're just using our own body weight. At this point, we could then progress on to using resistance bands, and there's a whole host of different colors of resistance bands, and each of the different colors represents a different level of resistance. And so again, working our way through that, start small and use the resistance bands that are sort of the most flexible with the least resistance, and build your way up to those that are quite stiff and have a lot of resistance. And we can use those to almost like you would use a barbell or a dumbbell, and use the resistance band to help apply some resistance to the different activities that we're doing. At this point, you would then progress on to using hand weights or dumbbells. And so typically, once again, you can start quite small and then build your way up. You could do squats or lunges, or there's a whole bunch of different resistance type exercises that you can do. Many of them you'll start with body weight. So squats, you could start with a body weight squat and start to progress such that you're then holding dumbbells or hand weights, either like a goblet squat or by your sides, just to add some added resistance to the added weight to the exercise itself. Once we're done progressing from our dumbbells, then we would move on to a barbell. You can see that in the bottom right picture. And so this is where you have a bar, and it's usually a large bar, and you add plated weights to either end of these. And so once again, if we think of a squat, we've started with a body weight squat, then we've maybe upped it to using a dumbbell or multiple dumbbells, and now we might do a squat with a barbell with the weight of the bar and then any added weight with the plates that you might add to it from there, and do your squats like that. So we want to progress in that order, starting small, starting with body weight, working our way up to resistance bands, then to hand weights or dumbbells, and finally progressing to barbells. Once we worked our way through all of the different types of exercises that I just talked about on the last slide, jumping and plyometrics are our sort of final options. So these are some of the last impact exercises that we want to introduce in that postpartum exercise phase. Jumping and plyometrics can reveal some pelvic dysfunction in the form of urinary incontinence, prolapse, this pelvic floor weakening that we talk about, because what there is this high stress on the pelvic floor. You're jumping, you're bouncing, you're doing all of these really high intense, high impact exercises, and this is where we can really see those pelvic issues come out. And so if you do progress to jumping and plyometrics and you notice any concerns related to your pelvic floor area or abs or your scar or any of those things, then we need to take a step back. We're not ready for jumping and plyometrics. As we've been saying all along, you are your own expert when it comes to your body. And so if you think it's not right, it probably isn't. You need to watch for these red flags. Postpartum women who have not experienced urinary incontinence up to this point may find that all of a sudden they are experiencing incontinence for the first time when they're attempting jumping or plyometrics. And this is when you need to then take a step back and come back to it once there's been some significant healing. So what about the intensity of your resistance exercise? You might be asking yourself, okay, so I know some of the safety considerations that I need to think about, but what do I do? Do I just start doing squats until I can't move anymore? Well, no, that is not the case. At this point, there's no definitive intensity maximum once you begin this resistance exercise. And so typically we would instruct people not to start until they're at minimum 13 weeks postpartum, and then you can start. And like we've been saying all along, listen to your body. You know when something does not quite feel right, and that means you need to take a little step back. If something doesn't feel right, it likely isn't. So start small and build from there. Maybe start with just a few squats, maybe 3 squats. And then if that feels good, next time do 5. And then next time do 10. And then do 2 sets of 10. And sort of build it from there. Listen to your own body and build it based on your capability. Okay, so is resistance exercise safe in the postpartum period? Well, when done correctly and all of those considerations are taken into account, then yes, resistance training can be a safe form of exercise for postpartum women, and it can supplement your postpartum recovery and improve your quality of life. You know, we've talked about the positive effects of physical activity as a whole. Going for walks, going for a bike ride, doing all of this movement of your body is so helpful. And so resistance exercise just adds to that. It's a supplement to that. So as long as you're taking all of these safety considerations into mind, then it can be quite safe. So to finish up, the next 3 slides are just showing some examples of appropriate resistance exercises that you can try. And so you'll see on the left single arm rows. So she is using dumbbells in this picture. You could consider doing it with a resistance band where you stand on the band and so you're pulling up from there. She's bent over so that she's getting gravity against her as well. In the middle, you can see walk plank rotations, so where she is planking on the wall with her lower arms, and then she's sort of rotating to the side and then back to the middle, then rotating to the other side, back to the middle. On the right, we've got wall push-ups to an elevated push-up. And so, yeah, push-ups are one that you can really progress. You can start where you're standing straight up straight up and down, and you're pushing on the wall back and forth. Then you kind of slowly start moving your legs further and further away from the wall. And this is now having gravity kind of working against us, so adding more and more resistance. And then we can start to, move down to the ground, to the floor, and be totally horizontal, down on your knees to start with, to lessen the amount of body weight that we're using. And then finally from our toe position. Other considerations for push-ups include the direction of your elbows. You can have your elbows pointing out as you are dropping down in the push-up, or having them pointing back. And this helps work different muscles of the arms, back, shoulder. On this one, you can see top left, we have supine leg lifts. And so this is an working resistance exercise. So you can consider doing this with both legs where you're raising them up. And then as you lower them, start with lowering them all the way down to the floor. As you progress, you can lower them down, but not quite go all the way down to the floor. So your heels don't quite touch. They're just sort of hovering and right back up. You can do this single leg. You can do it with a slight bend in your legs. These are all different ways that you can modify to make it easier and more difficult. Some of the things you do want to make sure that you're doing is making sure that this feels right with your abs, that we're not seeing any red flags. You also want to keep your bum and your back planted on the floor. If we're using those as momentum, then we're not working the muscles that we were hoping to work. And same with your hands. You want to keep them nice and firmly planted beside your body. On the bottom left, you can see dead bugs, and this is the same thing where you're now lifting an arm and a leg, and we're doing single, or you can do double leg, double arm, where you're raising your arms and legs up into the air and then lowering them back down, arms above your head and legs down to the ground. You can see bridges in the middle, so this would be working our bum and our hamstrings. Once again, you can do this as you can see here on the page, so 2 feet flat down on the ground, raising your bum up. You can do them with one leg elevated. You can do them with added weight onto your sort of pelvic area. So lots of ways you can modify to make it easier and more difficult. Wall sits. This is a tough one. So top right here, you can see her on the wall. Of course, the lower down you go, the more of a 90-degree angle that your knees have, the more difficult it becomes. If you are a little higher up on the wall, it becomes a little bit easier. And so again, progressing through this one. To make it more difficult, you can add some weight to your lap. And you can obviously do it for whatever period of time you want. You could start with 10 seconds and work your way up to 2 minutes. You know, this is just an example. And finally, on the bottom right of this slide, you can see the quadrupled leg lifts. So this is where you're on your hands and knees, and now you're going to one leg at a time, raise it up behind you, straightening it out, and then you would drop that and either keep doing that leg or the other leg. And final slide, the last two sort of exercises, a little bit more of a stretching and breathing type exercises. You can see on the bottom left, diaphragmatic breathing. So laying on your back and really thinking about breathing in and then breathing out. You can do it where you breathe in through your nose and out through your mouth and really counting it out nice and long and slow, really emptying out your lungs completely on the exhale. On the right-hand side, you can see a cat-cow. These are yoga moves, really great for stretching and really working on your breathing and your body movements, really getting that stretch in and feeling it nicely in your back and in your arms. Okay, so these are just some examples of some resistance exercises that you could start with, and then we can work on progressing from each of these. So I hope you've learned what you need to really consider before doing resistance exercises in this postpartum period, and I'm happy to answer any questions that anybody may have.